Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dall Simons Jr. Family Broadcast Studio here in the hospital. We are delighted to be back with you on this rather windy, stormy Thursday morning. Joining us in the studio are two COVID-19 long haulers. Amber Stiles is a Senior Director of Regulatory and Clinical Risk Management here at KU. I've known Amber for years. She does an amazing job, and we are delighted to have her here. Thank you, Amber, for being here. It's very kind. I said, Amber, did you tell everybody in your family that you were going to be on the program? She's like, I've told no one. Also, is Chaplain Daniel Freeman. I had the pleasure of meeting Chaplain Freeman here in the last few days. Actually, I think we met yesterday afternoon, and he said, now, I'm a little nervous. Is this going to be okay? I said, yes, sir. We will make sure we treat everybody fair and square. So thank you guys both for being willing to come on this program, share your stories. I think it takes a lot of bravery to do that and to have to talk about COVID-19. We will hear their stories in just a moment, but first, Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control, joins us from Colorado, where he's enjoying some mountain time, because one thing Dana does not do as well as I do is vacate. When I tend to go on vacation, I'm like, I've had enough. And Hawkeye hangs right in there. So, Hawk, how did we do overnight?
I love punishment. We had a meeting earlier today, Steve, and our numbers looked better. Overnight, we had 8 active infections. Unfortunately, through the nighttime period, we have kind of increased again. We have 12 active infections with 2 in the ICU, 2 on the ventilator, still 10 in that recovery period. Hays has 1 patient as well. You know, we continue to see increasing numbers. I wrote one of my ID colleagues down in Springfield yesterday, and really it was a short response, and it basically was, it's bad down there. And then I got another text and another communication from another local physician friend, within the last week as well. And I think I mentioned this yesterday. Young people he's seeing in the hospital, otherwise healthy, unvaccinated, but there because they have COVID-19 and pretty sick. And so really, we need to continue these vaccinations. These areas that are hard hit are mostly hard hit right now because of lack of vaccination. Yeah.
I think that's what we know, and the hospitals in Springfield have really felt that pinch. They got hit really hard again. They're up to 80 admissions. The average age was 42, I think, Hawkeye. Much younger. I mean, our average age was around 60-something. Now into the low 40s. They're having patients in their teens and 20s admitted. This is a real threat to everyone. The Delta variant is not as selective for old people as the original Wuhan virus was. This is much more about really can affect any and everyone of any different age group.
Yeah, absolutely. And we're still learning a lot about the Delta variant. We have a little bit more information now about the Alpha variant as far as its virology goes. Really, how does it work the way it does? Is it more transmissible? Why is it more transmissible? Does it replicate longer and you shed virus longer? Does it bind tighter to our receptor? Do you create more? Do you replicate more? Or does it have effects? And we believe we have some early data to suggest that the Alpha variant, has effects to help reduce our immune response to it. That could be very well with the Delta variant as well. All of those basic science studies and investigations are ongoing.
So, Hawk, I just have to say I'm impressed. You and I were on the same discussion here that was at 7 a.m. with our medical staff and provider staff. And, dude, you had glasses on. I haven't seen you in glasses hardly. And now your glasses are off. Talk to me a little bit about this cosmetic change you went through.
Well, it's probably not enough cosmetic change. I need a lot more than glasses. But it was early. It's early in Colorado. And I want to wish safe travels to our physician friend and my friend Chris Brown, who's traveling back now from Breckenridge here back to Kansas City. But it's early on Mountain Time.
Okay.
So that's why,
I just want to give you a hard time. I can't let anything go, so I just had to give you a hard time about that. So, hey, before we jump into our discussion with Amber and Chaplain Freeman, let's see if there are any reporter questions out there.
I have one from Donna at Channel 9. She says, how concerned should we be about the reports of heart inflammation in younger adults? who have gotten the mRNA vaccine. And is there anything folks who have gotten on mRNA vaccine should do to make sure that they are safe and that their hearts are okay?
Yeah, good question. We're seeing that the CDC Advisory Committee came out yesterday and said, listen, there are some cases of myocarditis. It does appear to be linked more to men than women. And with both Pfizer and Moderna mRNA vaccines, of course, there's a new one, the COVAX, that's probably going to come out at some point in the not so distant future. But what I'm reading, Hawkeye, is that first of all, it's self-limited. Second of all, it's very mild. And third, I think the odds of getting it are like one in a I forgot what it was. It's like 1 in 500,000, I believe. And don't quote me on that. But they were very low, far less than having severe problems from COVID-19. And certainly, as we'll learn in just a few minutes, far less devastating than long-haul syndrome, which occurs in young people as well as old folks like me. And so I would just point out that I think it doesn't detract from the overall safety of this. It is not surprising. And remember that COVID-19 itself causes heart inflammation in about 2% of patients. So at least based on some athlete studies that have come out over the last year or so. So Hawk, I'm thinking it shouldn't slow down the march toward vaccination in young people at all.
Yeah, I agree. We don't want to minimize it, but we have to, explain what it is. And just as you said, it's transient. It's very minimal. Does not lead to any severe disease. I think your point in the fact that problems with COVID-19 are much more prevalent than this issue. And again, you also mentioned the specific subset of patients which are more likely to get it, and that's that younger group of people, especially the males or men more than the women or younger females. Again, don't want to minimize it, but it does appear to be transient, doesn't appear to be severe. I would be more concerned if you actually got COVID-19 and got the myocarditis or that heart inflammation from the disease itself. We know that the side effects or the adverse effects of COVID-19 itself are much, much worse and much more prevalent than getting the vaccines. Again, I stated before the vaccination, my concern is if I got COVID-19 would be the blood clotting issue, the blood clots in the lungs, and the legs, and those other places. I feel more protected now. Again, the COVID-19, the disease, is much worse than any of these side effects or adverse events from the vaccines.
Yeah, I'm with you, and I'm firmly there. Get everybody vaccinated. And also, just to point out some interesting correspondence in the New England Journal of Medicine new online edition today looking at transplant patients. We've had a lot of questions over the time about transplant patients, whether or not they're going to get how much vaccination they should have. And it was in a study of 100 consecutive transplant patients when they looked at the vaccine antibody titers rise. Only 40% of patients detected that after the first two vaccines, but it jumped to 68% after those getting a third vaccination. I wonder if we might see now. Again, I think that there's other protection coming from the vaccine, but I wouldn't be surprised to see even a third dose being recommended in some severely immunosuppressed patients.
Yeah, I agree. We had this question early on in our physician update. This has been something that's been ongoing in our immunosuppressed, particularly our transplant population, because we know the number of different drugs and the combination of drugs that those patients can be on. Overall, the stance from expert opinion in the transplant world had been to not check antibodies because immune responses are much more than just an antibody response. But at this point, don't give that third dose. This new information now may help us to resolve some of that question, but also provide more protection for those immunosuppressed patients with giving that third vaccine dose. And I'm sure there will be more guidance coming out fairly quickly now based on this correspondence.
Yeah, I think it will. We're not really proposing a change yet, but I would keep our eyes out there. We'll remain sharp about it and let people know.
Yeah, and I would like to say, too, there's also some mixing studies going on with different vaccines. I think this plays a little bit into that as far as if people are getting more than the suspected or the regular dosing of vaccines, whether that's the 2 doses of Moderna or Pfizer or the 1 dose of Johnson & Johnson. Overall, I don't believe there's going to be a problem or a safety signal with the mixing if that happens. And just as you mentioned earlier on in that meeting today, Angela Merkel has mixed as well. So I think adding more or giving more vaccine in these controlled manners is not going to affect safety and will hopefully help efficacy and keep people safe.
Yeah, I think that's right. Let's see if there's any other reporter questions out there. Not
Not at this
hearing
time.
any. All right. I want to turn first to Amber Stiles. Amber, you and I have known each other for a lot of years, and first of all, I'm just sorry you had to have COVID-19. Tell us a little bit about when you think you got it, and then talk to us a little bit about what long haul syndrome has meant for you.
Okay. So I knew I had been exposed. I was in close contact with a friend for probably about 30 minutes, unmasked, and knew better. And as soon as she began feeling symptoms, she contacted me. And at that point, my focus was on, am I having symptoms? And also distancing myself from my family. My goal was to not expose my family. And so at that point, I went through about a week. I was notified on a Sunday. By that Wednesday, I was sneezing, which I kept thinking, no, that's nothing. Sneezing is not a symptom. And then I had a little cough on Thursday. And Friday, I was working from home, and it was 10 o'clock in the morning, and I suddenly just felt like I wanted to lay on my floor and take a nap. And at that point, I knew I needed to get tested, and I just knew I had COVID. From a long haul standpoint, so the fatigue, I think, was the thing that really pulled me down. It still pulls me down at times. I am not a napper. I wasn't a napper. I am a napper now. I probably tire much more easier than I did in the past. My first 4 days of COVID were the worst. Severe headaches. I could sleep. I think the first day I literally slept 20 hours. And the cough, the cough wasn't horrible, but it was there. It was very dry. And just it also added to the headache. The headache was debilitating. Had to close eyes, couldn't focus or function. I never had a fever. That was the one thing that was, I waited to see if I would experience that. And then I lost it wasn't initially, I think it was about 3 or 4 days in, I lost my sense of taste and smell. And I didn't recognize it initially. Suddenly I have 2 grandkids, and my I think it was day 4, I had double masked to give my husband a break, and went to change a diaper, and I couldn't smell it. And so I knew right at that point, uh-oh. And with the taste and smell, it's just I don't know how to explain it. It's the weirdest thing. I regained it slowly over the course of a few weeks. Things even today are a little odd tasting at times, and it will take me back to and remind me, oh yes, you had COVID, you lost your sense of taste and smell. But today I feel good. Mornings are my time. I feel okay today, but still the exhaustion is there.
Yeah, that's good. And how long has it been for you with the exhaustion?
November
Okay, that's
1st.
a long time. Has it gotten any better?
I feel like it has. When I probably the first 2 months were probably the worst of it, with the fatigue. I mean, it was literally daily, and when you get like that too, you're just kind of like this fog comes over you, and so your focus is off, and just being able to stay focused in the moment of whatever you're doing sometimes is difficult to see through that. Got the vaccine, and then after that it really just kind of started to subside some, but it's still there.
Well, I hope you continue to get better. I want you to get all the way better. Amber's one of our best, so just a shout out to thanks for being on the program. I'm glad it's in your morning. I'm glad we're here for the morning part of that program.
You bet.
Chaplain Freeman, thanks for being on the program today. Tell us a little bit about COVID-19 and how it's affected you and when you got it, and then what's happened with long haul syndrome.
Well, I was actually here at the hospital when I finally figured out that something really was going on with me. It was back in March of, I think it was around the 27th. It was a Thursday. I was here to do my overnight program, and around 9:30, I just got real tired, and I never felt that fatigue in my life. Being an athlete, running hills and all that, never felt it that way in my entire life. And I ended up laying down about 9:30, and that next morning, that Friday morning when I got off and went home, took a shower, got in my chair, couldn't move. It stayed that way all the way until Monday or Sunday. I'm a pastor as well, so I called my superintendent and told her that she needs to teach Sunday school because I couldn't do it. Monday, I went to my doctor, went in. They said I had a temperature of 103. I had no sweats, no pains or anything. They told me to get to the emergency room right away, so I came here. I was admitted that Monday. I spent 7 days here in the hospital. Ran into some difficulty breathing while I was here, and knowing a couple of people that had it, they was on ventilators. I was afraid. I saw work in my lungs, breathing, and all those different things. And even today, I'm doing better. I actually started feeling better after I got my first shot of the Moderna. I could tell the difference.
Isn't that interesting?
It is. So I still run into the fatigue, get tired. I'm not nowhere near where I used to be. I was blessed to be able to retire from the fire department, which was a blessing because I wouldn't be able to do the job. Putting on the SCBA, trying to breathe, it wouldn't happen. So
you're both a fireman and a chaplain.
Yes, sir. I retired. Actually, it's kind of strange. My last day, my retirement day was April the 1st. I was here in the hospital on my retirement day. And so, but I'm here now as a chaplain, enjoying it and trying to share with everyone the importance of the vaccinations and taking care of yourself and learning your body and making some differences, some changes when something happens. Don't be afraid to speak up.
Well, isn't that right? And so thank you for being here, and thanks for being willing to be a part of this program and for your service to our community as a fireman and as a chaplain. Are you getting better with time?
I have some good days. And my good days, I have to be careful not to take advantage of my good days because I found out when I took advantage of my good days, it seemed like it took me about 48 hours to recuperate, sometimes 72. So I try to pace myself. So I do have I'm having a lot more better days now. I'm doing a lot better.
That's good. That's really good. Well, I'm glad that it's better, and I want you to keep having those really good days, and it's got to be tough. So talk to me. So you say you get the first dose of Moderna, and that helped. Did the second dose help as well?
Yes, sir. I believe it did, and I give credit to that. Of course, I being praying and learning the body, but it helped me a lot once I got that first and that second dose.
All right. Well, that's a big deal. So thank you for being on our program today, and we'll come back to you in just a second.
Thank you.
Did vaccination change it for you?
So the first vaccination, without anything, the fatigue I did feel that lift initially. I don't know if that was more of a mind thing or not, but when I got the second vaccine, I just felt funny, and I had about 24 hours of that fatigue again, and body aches. But then after that, it subsided, and I've not had any issues with the severe fatigue since I was vaccinated.
So maybe it did help your long haul syndrome a little as well. It's interesting because we both are really kind of saying that same thing about especially that fatigue. Hawkeye, what do you think about that whole fatigue and vaccination and feeling better from long haul even after vaccination?
Yeah, I agree with the chaplain. A lot of healthy people, especially even young people, have problems if they're being active after the infection. There are anecdotal reports, and there's, I think, a very small study looking at improvement in long haul symptoms after vaccination. About a third of those people have had improvement in symptoms. those investigations are ongoing. We know that anecdotally we hear those stories. We've seen those stories in the news. Hopefully it will help overall. We don't know exactly why. Is it maybe resetting some of that immune mechanism that is still causing some of those symptoms? But, we want people who have long COVID to get better. And it takes time. But also, if there is some improvement from vaccination, we certainly want to encourage that because we know it affects daily living. We know it affects daily things that you're doing. And if it affects you, it's affecting your family, your loved ones. We just want to get you back to feeling good. I saw a report today in the Washington Post where they think up to 2 million people in England may have that. So it is a very significant problem. I get texted probably every week about patients and friends who want to get into our multidisciplinary long COVID clinic. So we really try to help people get into that. We take internal referrals from our patients, but also external referrals from other physicians too, to get into these long COVID clinics to really try and see if we can help people and their day-to-day living.
It has been so darn busy in those clinics. There's just a lot of folks out there with this, and just one more reason to get vaccinated, because we know that people who are vaccinated don't get long haul syndrome. So I think that's an important thing. So guys, Chaplain Freeman, first for you, has this disease impacted your work, your relationships, families? Talk to us a little bit about that.
Yes, and I do all I can not to allow it to affect me, but because of the fatigue, I haven't been able to go certain places. Dealing with my boys, they were active in sports, so I tried to go and do things with them. Being a pastor of the church, I hadn't been able to do a lot of the activities there. Here at work, when trying to get around and running into that tired feeling, have to go and sit down and being careful, because sometimes when I get real fatigued, I start to get headaches and trying to monitor that. So I'm just trying to be real careful with it and just learning my body all over again and trying to make the best of what I have to give.
I've heard others say what you just said. I think it's a really great turn of phrase there, that you have to learn your body all over again. Amber, is that something you felt as well?
Yeah, and I think too, I would just want to touch on the mental and the emotional impact on you. I think I think a lot differently even today, being vaccinated, much more mindful of, if people are around, where I'm going. It's just I cannot put my guard down, and I think that's probably been the hardest as I move forward. I'm a very outgoing person, love to be around people, and I'm still in my house. I go to the store, I venture out every once in a while. I love to do outdoor things. I actually went to a baby shower last weekend, which was the first time I'd been around people unmasked, but my friend was everybody's vaccinated, but even with that, you're just very mindful and of who you're around and what you're doing. I think from a quality of life, it is also very difficult just to get the drive to be able to get up and go and do things, because you are tired. I am tired, and I tire much more easily than I did in the past. And so I think through all of that, how long is the day going to be? Is this a significant drive? Am I the driver? I have to think through all of those things.
Yeah, those are the things that, really do impact your life and your family in an ongoing basis. So, please.
Steve. Yeah, I would also like to point out, just looking at a new study in Nature Medicine that looked at young people, but also people that were just at home. They weren't even ill enough to go to the hospital, but even at 6 months, these young people in Norway, even 30 and below, even though they weren't ill enough to go to the hospital, they stayed at home, they isolated. Even at 6 months, 50% of those continued to have problems like loss of smell, impaired thinking, memory problems. So it affects people even if they are not ill enough to go to the hospital. It affects even young people.
Yeah, so again, we just can't emphasize enough the importance, and I think you guys would probably tell us the same thing. Amber, in view of the Delta variant, what would you say to people about vaccination now?
Please get vaccinated. And I just believe that it's so important. Millions of us have received the vaccination at this point. So from a fear standpoint, you can see that the impact of being vaccinated versus the impact of actually having the disease, is much less of a risk. I just think that it's so important for your loved ones, for yourself, for the people that you are around to be vaccinated, to keep yourself safe and the individuals around you.
Keep yourself safe, keep your family safe. We like to say V for vaccination so that we can live long and prosper. Chaplain Freeman, what would you say to folks out there about getting vaccinated?
Well, I was hesitant at first, but after seeing the nurses and the doctors going forward and getting theirs, and I said, well, okay, well, I'm gonna go ahead and do it. And being a pastor of New Beginning in Lansing, that's something that I spoke to them about. We have some, I call them seasoned members, the elderly, and just sharing with them the importance of it, being vaccinated. And my way of thinking was, as the shepherd of the flock, if I'm here to lead by example, and then I started thinking, if I don't do it, why would I expect someone else to do it? And then also the fact that if I could save one person, and they save one person, it'll help us all. So,
eventually, we save a lot of people like that.
Yes. So I'm happy. I'm glad. I'm proud to say that probably about 95% of our church has been vaccinated.
Oh, that's impressive. That's really impressive. That's better than we're doing at the health system. So, congratulations on that. That's
yes,
outstanding.
Sir. Yes, sir. So I encourage it. I encourage it very much. My family, my mother, she was afraid of getting it because all the stories that you hear through internet and all that. And so she got it. My brothers. So I am a big fan of it.
Well, thank you for that, and thanks to you both. What a great expression from both of you about the importance of this. And you keep calling me sir. Sir, you're the sir, not me. Jill.
Yes, so we have a lot of questions, and we're going to start with Donna, with Channel 9. She has follow-up questions, and a lot of people are asking the same question she is. And that is, could you please tell us, each one of you, Amber and Chaplain, what month and what year you got COVID?
So I was exposed in October of 2019. I was tested on October 30th and received my results early morning on Halloween of 2020. Of 2020.
What a Halloween thing. Boo.
Yes.
Yeah.
So it Halloween of just last year?
Yeah.
Yes.
Yeah, that would be right because just go to the timing of the pandemic. So it would be
Yes.
2020, 2019, probably.
Yes,
didn't have
not
cases around
2019.
here. So yeah. Okay. Chaplain.
Mine was March the 27th of 2020. And I got
2020 or 2021? This year or last year?
No, last year.
Wow, you were one of the earlier cases.
I was
then.
early,
Oh,
yes,
goodness.
last year.
Okay.
I got out of the hospital April the 6th.
Oh my! So when you said April, you've had long haul syndrome for over a year.
Yes, sir.
That's really a long time.
Yes, sir.
I'm glad you're better. I'm glad vaccination a year later then. That was April of 2021 you got vaccinated. Is that right?
In October.
October of 2020 you got vaccinated.
Yes, sir.
Okay. And that you felt better?
I did.
Okay.
That's when I started seeing the change.
Yeah, okay. All right. Wow. It's
And-
approximately a very long time to be sick.
Yes.
I'm sorry you've had to go through that.
Thank you.
And Samuel wants to know if you guys could speak to fear. Why do people fear the low-risk side effects of the vaccine and not the virus itself? And then also, Amber, you made mention that you knew better than to take off your mask, but you did. And people want to know why. What
Yeah, because no
motivated
one ever
you to do
takes their
that?
masks off when they're not supposed to.
So,
But what
Yeah.
are we thinking, I think, is the question.
Yeah, talk to us first about the masking, then let's talk about
Okay.
vaccination.
So it was actually a car ride. It was we were carpooling to work, and it was raining outside. It was early morning. She jumped out of her vehicle, jumped into mine. We were just moving really fast, and I think when the thought happened, it was as we were, I turned the corner to come to the hospital, and all of a sudden you're seeing these masks, and you're like, oh my gosh. And, you know, at that point, we'd been in the car 25, 30 minutes together, and I think it was familiarity. Actually, other than my husband and 2 grandsons, hadn't been in a car with anybody for months, and I think it was just without a thought. We just jumped in. We were talking. We were kind of in a hurry, and drove.
And just to say that story's been told in our country thousands of times as people have had it. So why do you think there's still vaccine hesitancy?
You know, I think there is still there's individuals that don't believe that the disease exists. I can say that it does. And I think there are, you know, things that are out on the internet with what the vaccine can do to you. I briefly saw a segment on TV. I don't know what I was looking at. I turned it, where people were saying things were sticking to them from like magnetizing, and just things that to me just don't really make any sense. Quite honestly, I mean, I can't speak for everyone out there as to why they're not. I would think that fear is probably the primary thing, but you know, I'm still upright. I've not had any side effects from the vaccine. My side effects are from having COVID.
They also want to know what type of vaccine you both got.
Moderna. Mm-hmm.
Chaplain, talk to us a little bit. Why is there vaccine hesitancy?
I had the Moderna. I believe it's because of political reasons. When everything was going on, how all that took place. I think a lot of the fear also is because how quick the testing or how quick the vaccine came out. And a lot of people feel that it takes 5 to 10 years to get things approved from the FDA, and so because how quick, you know, okay, you can have this, it's going to work for you, and so on and so forth. And so that's a lot of hesitation. And then I think we have a lot of people now that think that they know more than scientists and doctors for whatever reasons.
Because the internet's so darn smart.
It is very smart, and,
Yeah.
and there's no mistakes or no false
news.
nothing in there. So I think that plays a huge part. I also feel that because of the lack of understanding and what I like to call unfamiliar territory that we find ourselves in, it creates a lot of issues. And that's one reason why me as a pastor, I mean, I love my congregation. I'm there for a reason. And if the pastors don't speak up, you know, it's going to fall between the cracks. And so I think that plays a huge part in it as well. And we have to get away from the politics in it, the Republicans, the Democrats, and so on and so forth. It's real. It's real. And we need to speak that it's real.
Yeah, I think you raised a good point that, and most of the time in Hawkeye, I don't think I can remember a time like this, really, where vaccines have been so politically polarizing. I mean, there have been people who didn't want to take influenza vaccine for a while, but I can't say that it was a political issue. This one has been much more politicized than others that I can think of now. Maybe the flu pandemic would have been thought differently of 1918, 19, but I don't remember that. Obviously, I'm not that old, but I don't know. Can you think of another vaccine that is so politically polarizing?
No, and you know, even in 1918, people understood the risks Throughout history, we have had infectious disease that has affected the human population. Smallpox is one of them. Polio. I think the problems with vaccine hesitancy are many and multifactorial. Absolutely agree with our guests. It started really to gain traction with the debunked and disgraced physician Andrew Wakefield with the autism claims of MMR vaccine. The voice grew louder with celebrities who claim, such as Jenny McCarthy, who claim that it causes autism. I don't really understand or know if these celebrities have medical degrees or PhDs in basic science or virology, so I don't understand their expertise in talking. So that is one thing. Obviously, the political issue has really come to the forefront during this, which it didn't have to. This is a medical issue. It's fairly black and white. We know the devastation, the tragedy, the morbidity, the mortality that this infection causes. We know the way to stop it. We in the healthcare setting, not only physicians, but all the first responders, all the basic scientists looking to help the world to keep people safe. We know that we are just trying to do that. But we understand also some of the socioeconomic and certain populations, obviously very real for the Black population with historic, what has happened during medical care and experimentation. 100% understand that. So there are many factors, and some of those things are very real, such as the Tuskegee and the experimentation, but then the other things, such as the politicization, did not have to happen. So it is multifactorial. We are continuing to let people know and understand that these are safe, these are effective. We just want everybody to be safe. It's proven that when you have populations and communities and countries that are healthy, the production improves, the standard of living improves, the life expectancy improves. We know that during this past year with COVID-19 and the pandemic, the life expectancy in the United States has dropped significantly. So very many issues we have to work through and dissect them out one by one and really address them head on and try to let people know that these vaccines are safe. We are just looking to help people, keep them healthy, and keep their loved ones and themselves healthy.
Yeah, I think well said. Thank you.
Megan wants to know, with the Delta variant out there, what do you think about 4th of July celebrations?
Yeah, this question popped up yesterday, and I think the answer is stay outside, stay outside, stay outside. And if you go into crowded indoor spaces, even though the CDC says that if you've been vaccinated, you don't have to wear a mask. There's an article today in the New England Journal of Medicine that talked about there is a risk reduction to those around if the person who's positive is somebody who has been vaccinated. But it doesn't go away. It's a 40 to 50% risk reduction. It's not 90 or 100%. And so I think the answer is if you're in a crowded indoor setting with a Delta variant, you still wear a mask, Hawkeye. And I know I may be a little out of line with the CDC there, but that's where I'm thinking, at least right now. What are you thinking?
Yeah, I agree 100% with that. That was a good reference for that New England Journal paper. We've seen these coming out now. One by one, that if you have people who are vaccinated within a household, because we get this question about children as well, if you have people that are vaccinated within a household but other people are not, you have a significant reduction of transmission of that virus throughout that household. So again, I think it goes to the basic concept of population or herd immunity, and that is the more people that are vaccinated and protected, the less people that are susceptible to the disease to get the disease and also spread it.
Yeah, I think it still makes a difference. Okay, Chaplain, here's a hard question. I promise I went through them. It was a semi-hard one, actually. Are you still masking on inpatient services at your church?
Yes.
Yeah,
Yes.
So are we at my church. I go to Community Christian Church, and I think we're still got masks on, and that keeps coming up, and I keep coming back to the same answer. Guys, we're taking care of each other. We've got a lot of unvaccinated people amongst us. We can't not wear a mask yet.
Yes, it is a requirement that we put in place. We check your temperature. We ask you, have you been feeling any, having temperatures or sneezing and all that? I mean, and you have to sign in. We're doing all that.
Yeah, it so makes sense. Amber, what do you tell folks? I know you're kind of a church-going sort, as I recall. Are you guys still wearing masks?
Yes, I do. I even going into the grocery stores, I am still masked. There are times where I'm not masked, especially at my 6 a.m. runs. But I'll go in, and my mask is right there. If I start feeling people are getting close, my mask is on. I don't know you. I don't know if you truly are vaccinated. And so I'm just still very cautious.
Okay, so we have about 20 questions here, and they just keep coming in. So what I want to do here is see if we can rock through some
Okay.
really fast, because we're really running down of times, but these are good questions. And Wendy and anybody else who wants to know how to access the Long Haulers Clinic, get a pen right now, and I'm going to give you a phone number in just a second. All right, LP wants to know, Delta variant has been found in KC Metro wastewater. Is this a new occurrence?
No, Delta variant's been in Kansas City, it's been in Kansas, it's been in Missouri. It's not new. It's been out there for a while. We expect it to be the dominant strain very soon, and so it's not new.
And wants to know, when will we need to get revaccinated?
Yeah, we don't know yet, Hawk. I think it's still, we're guessing maybe once a year, and both because of variants and maybe they may recalibrate the vaccine a little bit. But it appears so far that the vaccine immunity is pretty enduring.
Yeah, absolutely. We think that the durability of that, just as you said, I don't believe any time before a year from the original vaccine, because these vaccines still protect against alpha variant, Delta variant based on T cell immunity. So they are very good. I think if we were able to, or if the vaccine companies were able to pivot the spike maybe to add some more optimal spike maybe against the Delta variant, so you develop antibodies towards that, I think that's reasonable. But I don't believe really anybody is expecting to have a third dose or a booster any time before a year.
Yeah, I think that's right. And just to say, it does work against the Delta variant, although maybe not quite as well against the original or the Alpha variant, the vaccines.
Lindsay and Sharon have questions about myocarditis in children. What should parents be looking for? How does it present? And Sharon wants to know about it with children or with adults as well.
Yeah, the signs you would look for are the same as both children and adults, and it's really about having that feeling of being faint, having an irregular heartbeat, maybe some chest discomfort and shortness of breath. Any kinds of symptoms like that, make sure you're talking to your primary care physician, and if needed be, they can do an evaluation and take you to a cardiologist. But the good news is it's, by and large, it is almost entirely self-limited. Out of 1,000 cases that have been reported in the FDA discussion yesterday, I believe 11 have been hospitalized, so it's pretty unusual to be hospitalized. And I don't think, Hawkeye, check me on this, I don't know if there have been any deaths. Do you know?
I've looked for that in the news, in the media reports. I haven't seen any reports of death from the vaccine associated myocarditis. And I think the symptoms, just like you said, are probably going to occur a few days to a week or so after that first vaccine. But I think we've seen more after the second vaccine dose. But I think what we also need to understand is that we have seen actually more severe disease and heart damage with COVID-19 than we have with the vaccine. So you want the vaccine, you don't want to get COVID-19.
Yeah, we actually have a young patient hospitalized last week who was on ECMO, which is heart support because your heart can't beat well enough, who was a younger person who had not been vaccinated and got COVID-19. COVID-19 is still out there. It's not gone. The Delta variant's real. You should be concerned, especially if you are not vaccinated.
On this
Springfield proves it.
I'm sorry. On the myocarditis, they're also wanting to know, does that happen 3 days, 5 days, 7 days after the vaccine?
Gosh, what I was seeing was within 2 weeks, Hawk. Is that what you're seeing?
Yeah.
Yep.
Yeah, exactly. A few days to a week or so after that, the vaccine dose. Again, I think they saw the predominance after that second dose compared to the first, but that would be the time frame.
And just remember, the highest cases of new COVID-19 are in Missouri. That's the highest rate in any population in the United States. It's almost entirely in an unvaccinated population, and they're getting every bit as sick as before. The only difference is it's a much younger age group. Whereas before you thought, gosh, I'm young, I'm protected. Don't think that with the Delta variant if you're not vaccinated. The average age of hospitalization dropped from the mid-60s to 42. And there are a lot of 20s, 30s, and even some teenagers being sick. Don't wait. Don't pause. You need to get vaccinated. Delta is dangerous.
Okay, are we seeing more blood clots, Linda wants to know, in people that have cancer than other people?
I've not heard that, Hawk. No.
I haven't heard that anecdotally on the floors or in the ICU. I think identifying that early on in the pandemic and using anticoagulation has really been a lifesaver.
Yeah, for people with COVID-19, we may be there, but I thought that question may have been related to vaccine, and maybe I misinterpreted it, but I was saying with vaccine, I'm not seeing more clots in patients with blood cancers, et cetera. Yep.
No.
Okay.
Okay, a lot of people are asking, with the new variants around, is it still safe to go walks without masks with someone who won't get vaccinated?
I think outside is safe. I think it's been proven over and over again, and though I would say you're always safer to be with people who are vaccinated, there is no question about that. But I think being outside, even with an unvaccinated person on a walk, is probably safe. Plus, you're moving in the air as well. Hawk, what do you think?
Yeah, just try to separate a little bit. You don't have to be shoulder to shoulder on the walk, and I think with the turbulent airflow outdoor, you should be safe.
Yeah, and you're walking, so you're creating your own turbulence.
Let's try to do a couple more, and then
Okay.
I promise I'll squeeze some of these in for tomorrow, and we already have questions for tomorrow. But Kitty says, can an individual who has had COVID-19 as a long hauler get it again if exposed to the Delta variant? I have a friend who had COVID last year who was a long hauler. Are you guys afraid of getting that too, the Delta?
I'm afraid of getting COVID again.
Period. Yep.
Yes.
Chaplain.
I'm afraid.
There you go. I think that's the answer. Both of you are much safer because you've been vaccinated.
Yes.
So, yes.
Yeah.
Okay.
And we just have people that are sympathizing with you, talking about the depression, the forgetfulness, blood issues, and fears. They just want you to know that they sympathize with you. And then I want to read, I guess I'm going to end with Denise today because she's writing in caps. So I know
She got
that
your attention.
it does. I know
Okay.
that.
When my wife writes to me
Yeah.
in caps, it's not usually a good sign. They're saying.
And it's long, but I'm going to read it anyway. So, yes, Pastor, those are some of my fears. I know it's a gamble either way. The study of it all thus far, I want to know about why haven't the vaccines been officially approved by the FDA? And they goes on to know if people are dying still, like in Springfield, are those
They are.
patients dying? Do we have patients that are dying? And then explain why those that have been vaccinated still have to wear a mask.
Yeah.
And last thing is, are there any effects on liver, kidney from the vaccine?
There's like 10 questions you just wrapped
I know.
into there, Jill. I'm just saying. Jill is really good at this program. She does a great job. She really runs it. But man, when she wants questions answered, what she does. I got
Well,
the last
these are all
question,
Denise.
but there's
She's-
12 all
yeah.
in one.
Yeah,
So let's
one
pick it
person.
apart. Let's pick it apart. Are people still dying from COVID? Yes, they are. Are the deaths down? Yes, they are, except in Missouri and other states where they're seeing a rise in the numbers of cases. Is the death rate as high as it was when we had more 60 and 70-year-olds? No. But are people still very sick and getting long haul syndrome? Absolutely. And again, the long haul syndrome doesn't respect age. Remember that. It doesn't respect age, and it doesn't respect severity of illness. So you can get COVID-19 and you can get long haul syndrome even if you don't know you had COVID-19. So that's just one more reason to get vaccinated. Okay, I'm going to try them. Tell me the other questions you had in there. There were a couple.
Just the mask thing. If you've been vaccinated, why
I've
do
been
we still
vaccinated.
wear a
Hawkeye, I
mask?
think you wear a mask to protect yourself, but also to protect others. And again, the evidence is still there. If you've been vaccinated and you get COVID-19, the risk of giving it to someone else is lower, but it is not zero, right? It's not zero.
And what is holding up
Yeah,
FDA
it's-
approval?
We'll get to there.
It's
Masking.
significantly reduced for disease and for transmission. We understand that at least by 90% with some of the other variants prior to the Delta variant. We don't, again, have all the virology information for the Delta variant, but also you're also wearing a mask because you don't understand and probably have to assume that not 100% of the people in any situation where you are, especially indoors, are going to be vaccinated. So I think it's just more added protection, and you have to understand the risk and benefit of everything from there. And my answer to the why is there not approval yet, I think that's just built into the American or the FDA's approval process for medicines and vaccines in general. Now, overall, it has been expedited with Operation Warp Speed, but I think there are still some of those protocols that we need to follow.
Yeah, I think that's right. And so just a couple things. First of all, the stem of that question was, it's a gamble if you do, it's a gamble if you don't. No, that is not correct. It is not an equal gamble. And I don't want to present it like it's an equal gamble because, as we've heard from our two guests today, it is not an equal gamble. The risk of COVID-19 is thousands of times magnified more than the risk of the vaccination. Yeah. And because the vaccinations were so safe, we got early use authorization. However, any drug that comes into the market, you have to do a long-term follow-up before that drug gets full approved. It's not just the studies, it's also longer-term follow-up, even of some of the phase 1 and phase 2 trial patients, to see how they did to make sure there aren't long-term side effects. So what the FDA is doing is now making sure there's no terrible long-term side effects, which is why we get reviews about myocarditis and vaccine-induced clots. So the reality is those things are minimal, and I think the vaccine can be approved at any point in the very near future. So don't think that it's not taking a long time at all for the FDA to give final approval. Don't think like that. Here's what you need to know. Vaccines work, they're incredibly safe, and PPE works, and masking works. All the things we've tried to tell you from the very beginning of this program are true, and we continue to tell you those things because they're true. Don't believe in the made-up news network. You just have to separate out the science from the made-up news. And if you want to still listen to the made-up news because somebody makes you think that it's true, I'm sorry, I can't help that. All I can do is tell you the truth that we see every single darn day. And I promise you that both Hawkeye and I, as practicing physicians, we tell our patients the truth. And both of us have built a career, and I've had a long career in medicine, and I will tell you, my patients will tell you, he tells you the truth. And I'm just telling every one of you the truth. Don't listen to the made-up news network. The gamble and the risk of vaccination is nowhere near. It's not even on the same planet compared to the risk of COVID-19. And that is both a Star Trek, Star Wars, and a true reference right there. Okay.
All right, final thing is a phone number that I promised to give. And this phone number is the same number if you want to call and get a vaccine scheduled. So if you're interested in long hauler or you want to get a vaccine, call 913-588-1227, and they will direct you.
All right, tomorrow we will introduce you to Max Huntley, who recently had his 12th birthday. Happy birthday, Max. I'm not going to sing today, maybe tomorrow. You'll never guess what he wanted. Hint, he got it at the Hy-Vee Pharmacy in Jefferson City, Missouri. Well done, Max. Happy birthday. You're going to have a lot more because you did that. Max joins us with his parents at 8 a.m. tomorrow to talk about that story. And Lance Williamson, Infection Prevention and Control Nurse Supervisor, will join to help answer your questions. Final thoughts, Hawkeye.
We're trying to get Dr. Norman, too, by the way.
And Lee Norman, which would be awesome as we talk about this. So, Lee, if you're listening out there, join us. Hawkeye.
Yeah, thank you to our guests. Long COVID is very real. We have seen it. It affects even otherwise young and healthy people. Please get vaccinated. I think there was a question also about, does it affect the kidney or the liver? There's no evidence right now that the vaccines affect the kidney or the liver. We can't explain the myocarditis issue, but even in the lung, where there are those ACE2 receptors that the virus infects, we haven't seen any effects in the lung after vaccination. And just understand that when you have that immune response, it's because that spike protein is essentially going to get transcribed, and the immune response is going to take place in those lymph nodes. It's not going to take place really at other sites in your body. So the vaccine is safe. We don't see any other effects on your kidneys, your liver, your lungs. So please continue to go out and get vaccinated.
Yeah, vaccines keep you safe. Okay, Chaplain Freeman, thank you for being on our program today, sir. You've done a remarkable job. You need to come back. We need to be able to talk to you more about how you're doing. And also, what did we make sure you felt safe here on the program? You didn't feel like you got in trouble here?
Yes, sir. You did a great job.
Well, no, you did a great job. I just had to give you some questions.
Yeah, I'm thankful. Thank God for this opportunity to share with everyone, and I will continue to be praying for the doctors, the nurses, and everyone else dealing with this situation.
Well, thank you. Well, and you're a blessing to our hospital and to us this morning. Thank you for being with us today, sir.
Thank you, sir.
Amber Stiles.
Yes.
It is always a pleasure to be around you.
Thank you.
Thanks for being on our program today.
bet.
Final thoughts from.
Final thoughts would be get vaccinated, do your research, look at what the experts are saying, look at what the research, the results of the research say. more so than random internet information that's out there. But listen to the experts. It could save your life.
I don't know that I can add anything to these two outstanding folks today, but I do want to try this one. When you try to distinguish between truth and lies, ask yourself this. What motivates that answer? What's the secondary gain from somebody lying? Why are they trying to present to you something like that? Are they politicizing the view? Are they talking about history? What is it about trying to give you something that isn't true? We have told you every day from the beginning of this program, we will tell you the truth as we've known it, and I think we have paid heed to that principle every single minute of every single broadcast. We'll continue to do that because we can only find each other and help each other when we do it based in truth and not in lies. And that's why you can trust what we say. We'll see you tomorrow. Thanks for being a part of our program today.